So good afternoon, everyone. Thank you for joining us today for today's webinar. My name is Nick Reuter. I'm a research advisor with the Association of Municipalities of Ontario and Local Authority Services. We are joined today by Colin Anderson and Anthony Sam from MindBeacon, Glyn Davies and Sarah Ellison from Breaking Free Ontario, as well as Nicole Masura from Togetherall. As you may know, last spring, AMO partnered with MindBeacon to offer members access to digital mental health supports. The service is important to accessing mental health care and will help municipal governments offer their employees and their families immediate access to quality mental health supports. The convenience of the online platform allows users to bypass wait times and other barriers to receiving mental health support when needed. AMO has negotiated cost-effective pricing on behalf of municipal employers so that they can put the service in place quickly and efficiently. So today you'll hear about some exciting new developments from MindBeacon. They have partnered with Breaking Free and Togetherall to bring you a one-stop solution to support your employees' mental health. Each offer unique solutions that has improved the mental health conditions of Canadians. And so with that, I will turn things over to Anthony Sam at MindBeacon to get us started. Anthony.
Thanks, Nick, and good morning. Good afternoon, everyone, and a very good afternoon to the folks out in the UK, which is Breaking Free, Glyn and Sarah. So again, thank you very much for joining us. So we do have an exciting presentation today regarding, as Nick mentioned, the partnership with AMO and MindBeacon has been going for last spring, and we've seen a significant amount of uptake, especially from the smaller members, and we're seeing a significant amount of organizations or municipalities, especially in the rural areas, which is really exciting as well as encouraging, because those are the areas that we find that are don't have the services. But that being said, there are a number of municipalities in closer to bigger cities where we're seeing a significant amount of uptake. So again, welcome everyone, and welcome to Colin, Glyn, Sarah, and then Nicole. I'll pass it over to Colin now to start off with the MindBeacon side, and then we'll pass it on to the next individual. Thank you so much, everyone.
Thanks, Anthony, and thanks, Nick, and hello, everybody from Belleville, Ontario. That's where I am this time around. I'm happy to be here again, this time with our good friends from Breaking Free and Togetherall. I'm the executive VP with MindBeacon. Some of you might know me from my former role as a deputy minister with the Ontario government. And I'm also here in my capacity as a person with lived experience as a lifelong caregiver for my father, who was bipolar, and that was what brought me to work with MindBeacon. We've definitely enjoyed our past discussions with AMO, individual municipalities, Roma and OSM, and various others. And this is an important and a timely topic. Certainly with COVID, we've seen increasing demand for mental health services. We've also in recent months seen an increasing severity as well, and that's been picking up over time, not just recent months. We also know from past crises like SARS that the mental health impact of a crisis can last 18 to 36 months beyond the crisis itself. And the psychological impacts that are accompanying COVID, often referred to as the echo pandemic. We like to think of ourselves as helping to provide mental health PPE, so early intervention all the way through to people who are further along in their mental health journey and needing assistance at home, at work, at school. The good news is, and albeit by necessity, is that with COVID, patients, employees, funders, employers have all overcome some of the hesitance that they might have had about virtual health services generally, and we've been increasing our continuum of care. So with COVID, we expanded our workplace continuum. You see it on the page here. It includes a mix of free services, employer-paid services, and some services that are available thanks to funding from the Ontario government during COVID. The key is we're looking to provide affordable, accessible, and effective supports, and we've added things in response to demand from consumers and employees, like easier navigation, peer-to-peer support that we have with Togetherall that you'll hear about in a moment. Today, we're going to focus on our therapist guided program, which is there in the middle, but we also added live or virtual therapy by Zoom. And we've always had 24/7 crisis help included. So therapist guided ICBT is our most cost-effective treatment strategy. It's our flagship program. We've discussed it before on past webinars. Essentially, it is full-on cognitive behavioral therapy that is delivered by being matched one-on-one with the therapist who gets to know the patient or the employee. It's all evidence-based. We use regulated mental health professionals, and it's up to 12 weeks of treatment with no scheduled appointments. So it's great for shift workers because it's available 24/7. We know that 57% of people are accessing this service outside of regular office hours. So it really is helping with accessibility. In fact, 50% of our users are using the mental health support for the first time. So we're really helping people to access services, to help people who are living in remote and rural areas where there might not be local capacity. We're also speeding up the assessment process and the triage to the right kind of care, so we can onboard people within 2 to 5 days, so there's no wait time to do the assessment. We're continually adding protocols, and this service is free to all Ontarians at the moment during COVID, but also offered through employers across Canada, in Ontario, including municipalities here as part of the AMO program, because there are additional supports that go along with the AMO program. There's training, targeted communications, there's reporting specific to the municipal sector, as well as hands-on support for MindBeacon for implementation and the like. In the Ontario program, we've had over 28,000 people enter the program. So we've got lots and lots of data. We collect data weekly on symptom reduction as well as satisfaction. So we know that it works. We know that it's effective across all ages, genders, and severities, equivalent to first-line treatments like medication or face-to-face therapy at 1/5 the cost, which would be of interest to all of the folks listening in on this phone, and we get high satisfaction rates as well. We also have targeted content for first responders and healthcare workers, and we're getting equally good results with them. We also have a specific return to work program that may be of interest to you. And we put this slide up because it really speaks to results. We've been able to, compared to a control group, reduce the duration of somebody's leave when they're off work by 17%. And we do know that the earlier the intervention, the better the result. The less likely that somebody's going to develop more severe symptoms, the more likely they're going to get back to work. And we know that within 6 weeks of the absence, when we intervene with MindBeacon, we see a 37% reduction in absence duration. So for many of you on this call, mental health contributes to a significant, if not the biggest, portion of your disability management, both the cause and the cost. And we're here to help on that front as well. We've got a summary slide with more to talk to you about the range of services that we have. Just keep in mind, all evidence-based, all progress driven, very cost effective, and happy to talk to you more. And Anthony will talk to you a little bit about that at the end of the seminar. With that, I'm going to turn it over to Togetherall, who we have a great partnership in with our peer-to-peer support program. So over to you, Nicole.
Great. Thanks so much, Colin. Hello, everybody. My name is Nicole Mashura. I'm VP of Partnerships here at Togetherall, dialing in from sunny Scarborough, Ontario, which has been a nice change from the last 48 hours. As Colin shared, Togetherall has a great partnership with MindBeacon, and our peer-to-peer mental health community is available as part of the employer-sponsored MindBeacon suite of services. And I know there are a couple of folks on the call right now who use our services today. So I'd like to spend a couple of minutes just talking a little bit around who Togetherall is and what it is that we do. And most importantly, where I'd like to spend the time is around the why. So Togetherall really harnesses the power of what we believe to be the most untapped resource in mental health, which we believe is each other. And we do this through providing a safe online mental health community, a space that really encourages people to connect with one another with lived experiences and empowers them to share and to provide support to one another. We call ourselves a safe community because the entire experience is moderated and monitored by licensed and registered mental health practitioners, largely social workers, at all times. And I'll talk about the specific function of our clinical moderators in a minute. But I'd like to talk a little bit around the why Togetherall, the why a safe online mental health community. Togetherall was founded 15 years ago, really with the core belief that community is essential for humans in getting us through difficult times. We believe that community makes people feel less alone and gives people hope that they can get through their difficult time. And we actually see this sort of example of community. It's very obvious, but we see it kind of everywhere in the physical health space. You know, you get a cancer diagnosis, you get a referral to a cancer support group. I'm the parent of a child with a rare disease. Peer support groups are plentiful in the rare disease space. And even with various life stages, you know, you lose a loved one, or even if you give birth for the first time, which is both a positive but also a challenging event, family and friends come together. They come out and they support you. But what we know is that those who struggle with mental health concerns, they don't have that same connection. And what we also know is that depression and anxiety and really other common mental health struggles, they're often invisible to those around us. So our family and friends don't know that we're struggling. And these conditions also inhibit us from actually reaching out to our family and friends when we really need it the most. And we know that a lack of social connection and an isolation can often really exacerbate anxiety and depression and other mental health concerns. So these factors, all of them together, combined with, you know, personal stigma and sometimes cultural barriers, mean that there are so many of us that when we're going through a difficult time with our mental health, suffer alone. We also know, though, that people do want a community of support when they're going through a difficult time with their mental health. And we know this because we see people in the millions reaching out to places like Facebook and Instagram and Reddit and others in search of an accessible community. We also know, of course, and it's been in the news as of late, that these social media sites are unmoderated and can potentially be unsafe. So this is really what Togetherall aims to do, is provide this alternative community that's both safe and accessible. This sort of just shows that, you know, we do have a diverse range of experience in partnering with organizations in the UK, where we were founded, but increasingly in Canada, the US, and New Zealand, and have particular experience in partnering with public sector employers. So I'll talk a little bit around the role of our clinical moderators in ensuring that the community remains safe and supportive. As I mentioned, clinical moderation and monitoring is done at all times by licensed and registered practitioners. And they really have three roles within the community. The first is what we call vibrancy. It's making sure that the community remains inclusive and supportive for everybody. It is facilitating connections between particular members. And it's also ensuring that every post in the community gets a response. The second is related to risk and safety. So our clinical moderators are identifying individual members who are showing signs of risk, assessing that risk, and then escalating them to crisis supports as necessary. And the third is really related to service navigation. So the interesting thing about Togetherall is it's an anonymous experience for our members. So when you register or sign up for the service, you create an anonymous username like ABC. On the back end, through our technology, our clinical moderators know that A, B, and C is an organization XYZ employee. And they also know what other services are available to them beyond Togetherall at organization XYZ. So knowing, again, through our partnership that these employees have access to the ICBT through MindBeacon, through an employee assistance program, etc. And our clinical moderators identify individual members who could benefit from services beyond the peer-to-peer community and help make those connection points and service navigation back to the other employer-sponsored services and resources. And a little bit around sort of what we see, around a bit of a profile of who uses and who engages within the Togetherall community. Because it's a unique experience, it's anonymous, it is a community, we tend to see good, strong engagement and representation from employees who traditionally haven't reached out for help. So just over half of our members, 55%, report having shared something mental health related for the very first time in their lives within the Togetherall community. In the same vein, 40% of our members have really Togetherall as the only form of mental health support. And lastly, but not insignificantly, we tend to see overrepresentation from populations who have largely been marginalized and been underrepresented in mental health services. And the number one reason why is sort of citing the anonymity of the platform. So we actually have 40% of our members identify as either Black, Indigenous, or a person of color. If that's a little bit around sort of the who is engaging in the service, what are Togetherall members telling us about the impact of the service and of the community? As I shared in my opening, we're founded on the belief that community is essential in getting us through difficult times because it makes us feel less alone and gives us hope. And that's exactly what Togetherall members have shared. So 93% have shared Togetherall as being helpful to some facet of their overall well-being. 83% feel less alone and less isolated as a result of joining Togetherall. And 80% are now better able to cope. They're more resilient with their day-to-day challenges as a result of being a member. And that's everything I think at this point in time. And I will pass this over to both Glyn and Sarah to talk more about Breaking Free.
Thank you, everyone. And thank you for the opportunity to meet with everyone today. My name's Glyn Davis. I'm the Service Development Director at Breaking Free, and we are talking to you today from Manchester in the UK. And we would like to talk to you specifically about our services that are available to everyone across Ontario.
And I'm Sarah Ellison Davis, and I'm Research Director with Breaking Free.
And we wanted to engage with everyone today because Breaking Free Online is now available to all the residents across the province of Ontario. So for all your employees who may be experiencing difficulties with alcohol or with substances, they are able to access Breaking Free Online today for free at any point. And we know the difficulties that there are in terms of employees, in terms of the effects of alcohol and drugs around absenteeism, with people missing work days as a result of their drinking or drug use, but equally for presenteeism, for those individuals who are turning up to work under the influence or experiencing the hangovers and all the other resilience, the other aspects of their alcohol or drug use. And so Breaking Free Online is currently free to all residents. So literally anyone across the province can go to the website, breakingfreeonline.ca, and sign up using their postal code. The programme is completely confidential, and we know that across Ontario, there are waiting lists to access treatment services, that people often don't present to treatment services for their alcohol or drug consumption because of feelings of shame and stigma, other issues in terms of rurality, access to public transport, work commitments, having to attend work, and actually meaning that individuals then can't present to services, as well as other kind of concerns around social services, childcare arrangements, and so forth. So access to a digital platform like Breaking Free Online means that individuals can access these interventions immediately. So any of your employees can get the treatment they need. We know that services often provide medication, but it isn't as simple as just giving people access to medications. If it was, you wouldn't need substance misuse services. Breaking Free Online has been designed to offer 24/7 access to evidence-based techniques that have been proven through research to be incredibly effective. The program itself has been designed and iterated over the past decade to make sure that the program isn't just personalized to the individual, but it's very interactive and engaging. So we've always had feedback from people using the program about what works, what needs to be improved, and we've continued to iterate it to the extent that Ontario Health and the Ministry of Health in Ontario have commissioned the program and made it freely available to all residents across the province. Now, the program itself is designed to use cognitive behavioral therapy, a very proven and effective approach within substance misuse treatment. But the program also integrates into it lots of other proven therapeutic approaches so that people can interact and engage with the interventions that can really help them progress and overcome their difficulties with alcohol or drugs, and also maintain the gains that they've achieved. And the program itself doesn't help people just recover in terms of their substance use and dependence, but it helps them to overcome those comorbid mental health difficulties, such as anxiety or depression, that people often get into a cycle with. If they're feeling depressed or anxious, they may drink or use substances as a coping method, and that can often become a cycle. And Breaking Free Online can help people address and break that difficulty and allow people to move on in their lives and achieve different gains in terms of their lifestyle. But the program itself will really complement individuals if they are accessing services. It can help complement and strengthen people who are accessing medications. But Breaking Free Online can target over 70 different drugs, whether it's prescribed medications, whether it's cannabis or marijuana, whether it's alcohol, whatever any of your employees may be suffering difficulties with, Breaking Free Online would be a really good confidential treatment option for them to access. So all they would need to do is to go to breakingfreeonline.ca and sign up using their postal code. So next.
Yeah, so I think we've got a video now, Anthony, on the next slide. So would you be able to play that for us, please? And we'll just talk everybody through the various aspects of the program. So this is the landing page where people sign up or log into their account. And for anyone that's new to the program, they complete a short baseline assessment, and this just collects information around the substances they want support with, their mental health, their quality of life. And the program uses all of the data from the assessment to populate a personalized diagram, which we'll show you in just a second. But this is where in the baseline assessment, people can also set their goals as well, whether that be abstinence or reduction. So this is the personalized model, which shows the individual the various aspects of their life that might be having an impact on their substance use. So it uses a traffic light system. So the areas that turn red are the areas of their life that might be having the most significant impact. The amber areas, moderate impact, and green areas are areas where they're doing okay.
This is a relapse prevention strategy, so people can identify their high risks, think about coping methods, and come up with great problem solving, how they can avoid those high risks and manage better.
And the program also helps people to address their unhelpful thinking patterns or mind traps that can often underpin things like substance use difficulties or mental health difficulties as well.
There's different mindfulness techniques to help people manage those heightened states of emotions like anxiety, frustration, or anger that can often be a trigger for relapse. We teach people about cravings and urges and about how to manage those using a technique known as urge surfing. So this is a gold standard mindfulness technique that services use all the time.
There's also techniques to help people to plan their time more positively and put activities for enjoyment and pleasure for each day of the week to help them have structure, but also to improve their mood and motivation. And there's also a technique in the program to help people achieve their life goals. So whatever these might be, it might be to get fitter or to address your drug and alcohol use or to work towards a career goal. So there's also a technique in there for that as well. And for every single strategy someone completes, there's a personalized action plan, and all of the work that somebody completes on the program is saved in their recovery toolkit.
People can monitor how they're doing in terms of their drinking, their drug use. They can see the gains they're making. They can generate reports that will actually show them very visibly about the gains that they've made in terms of their CBT progress, how they're doing in terms of their medication or their drinking, their drug use, their goals. And they can also generate a report that can show family members or employers how well they're doing this time.
And you can also add the email addresses of members of your support network. That means that you can get that support from your support network at distance.
And there is a companion app that goes alongside the actual program itself. So people can access interventions very discreetly. They can be in control of their data plan, and they can get reminders about when to attend appointments, when to actually put into motion some of those life goals. So Breaking Free Online is currently available to all of your employees. It is free, it is fully confidential. It's proven to work with research, which is why the Ministry of Health in Ontario have commissioned the program for the whole of the province. And we know that the program fits really neatly alongside all of the services being delivered by MindBeacon and Togetherall. So we would recommend, if you do identify any employees in terms of having any particular difficulties with alcohol or drugs, that they should visit the website. And just to say, if you do have any questions or queries following today's discussion, we appreciate that time is very short. So we have tried to provide access to the overall content of the programme to give you some ideas about how it looks or feels. But please feel free to get in touch with us if you want any more information, which you can do at info@breakingfreeonline.ca. But fundamentally, if your HR department or any of your staff want to actually take a look at Breaking Free Online, they can literally just go to the website, breakingfreeonline.ca, watch the video on the homepage, see what they think of it, and give it a go. It's free to access, and it's ongoing free access for up to 2 years from when you actually create your account. So thank you very much for your time. That's probably the quickest we've ever talked through the presentation, and hopefully we're just within the 5 minutes.
Thank you, Glenn and Sarah. Very much appreciate your time, as well as Nicole and Colin. So I'll bring everything together now, in a sense, just to go through a few things on my side from a MindBeacon point of view. And I wanted to just reiterate, just in terms of what Colin mentioned. Again, we do offer multiple services for organizations, free as well as paid services. And I have just put Togetherall in the peer-to-peer. So when organizations or when municipalities do partner up with MindBeacon, it is included in a subscription model. So that's a price per employee per month. And it does vary since we have added different types of services, as you can see from the slide, is the price does vary. But typically, it's around $3 per person per employee per month. And then if you do add, for example, live therapy, one live session, the costs may go up slightly. So again, these are the mental health continuum of care approach that MindBeacon provides through the AMO partnership, and Togetherall we have a partnership with Togetherall, and Breaking Free is free, as Glenn and Sarah mentioned, to all Ontarians. So hopefully this gives you a very good idea in terms of the work that we are doing with AMO, as well as the partnerships that we have with Togetherall and the partnership that Breaking Free has with the Ontario program. Now, typically, many organizations or many people ask, well, what comes, the support that comes with a MindBeacon program? And I know Colin touched on it very, very, very briefly, but I wanted to give you a little bit more an idea of the support that we're able to provide to you when you do partner up with MindBeacon. So we do provide, we do webinars as a launch for your employees, as well as emails to send out to employees to encourage individuals to sign up for MindBeacon and use the services. Also posters, now that organizations are going back in person, you can put posters up, which is all very much personalized and edited to your needs. Intranet, if you do have an intranet, we have digital banners, as well as different videos that you can use when you are communicating MindBeacon. So there is a significant amount of support that we do provide. You do also get an account executive. So an account executive would work directly with the HR department or individual that is leading this particular initiative. And we can customize, like I said, anything that organizations would need. So there is significant amount of support, again, with Togetherall supporting, as well as Breaking Free. So I'll turn it back to Nick to go through any questions that we may have.
Great. Thanks, Anthony, and thanks, Colin, Nicole, and Glenn and Sarah for your presentations. I would ask our presenters if they could turn on their video right now so we can see your faces again for the Q&A session. Thank you very much. So the first question, and again, folks, if you have questions for presenters, please submit them through the Q&A function through Zoom. One came up during Nicole's presentation. And Nicole, I guess I'll pass it to you first, but please, Colin, Glenn, Sarah, and Anthony, feel free to weigh in as well too. Good afternoon. I wondered what the process would be if someone seeking virtual assistance is in full crisis. What is done to get them immediate medical attention? And then they have a qualifier if it were determined that the individual was a danger to self and to others. So I'll put it to Nicole first, and then other presenters can jump in as well too.
Yeah, it's a great and important question, and that is why our community is monitored and moderated by real live people at all times. And our technology is built in such a way that it actually helps draw our clinical team's attention to particular posts, keywords, groupings of words, phrasings of word, and interactions between individuals. So it's flagged. And in more or less real time, our clinical team reaches out via a chat function to the member that there is some risk that's been identified. And just that would happen at a crisis call center or at any other kind of clinical call center, our clinical team is determining the level of risk. It is seldom, it rarely happens, but it does happen where to your question, the risk is deemed to be imminent. So the individual is posing an imminent risk of harm to themselves or others. If that is the case, they are asking the individual member to disclose who they are because it is on the front end, again, an anonymous site. Most times people do identify who they are. They provide their name, their phone number, where they are, etc. And then another member of our clinical team actually makes the call out to the appropriate emergency services while the one clinical moderator is on the line, continuing to keep that conversation going with the member who's at risk, and then connecting them to the appropriate crisis support. So a very similar process that happens with crisis call centers. If for some reason the member who's at risk is not in a position to disclose sort of who they are, their phone number, etc. For example, the chat goes quiet, which can happen. Again, that's the benefit of our team being real life humans. They use their clinical judgment. And if the risk is deemed to have been imminent, they are able to actually pull some of that information from the registration process that gives their email address, their phone number, and most importantly, their IP address, so that they're able to provide that to crisis supports to get to the person and make sure that they're safe.
Great, thanks, Nicole. Colin, would you like to weigh in as well too?
Sure. So for us, when anybody logs in and throughout their journey, they always have the opportunity to link out to Kids Health Phone crisis line, which is available in our case for all ages. It's not just for kids. So they're providing support 24/7. We collect outcome measures, and our therapist, you're assigned one therapist who works with you from start to finish, so she gets to know you. She's watching your outcome measures. She's watching what you're putting in texts. It's not uncommon for people who are going through anxiety or depression protocols to trigger or flag some kind of thoughts of self-harm or harm to others and the like. So it's her clinical judgment to determine when something is flagged in one of those measures. She gets an alert. She reaches out. If it's determined that safety is okay, then the person just moves on with their treatment. However, we do collect an emergency contact, and we do have an escalating protocol that will kick in that can go up to and including phoning the emergency contact or 911. We are not an anonymous service, so we do have address and personal information, phone numbers, and things like that. So again, it's an escalating process, and maybe I'll leave it at that.
Thanks, Colin. Sarah or Glenn, would you like to answer the question as well too? Have any thoughts? Okay. So I've got the questions are still open, folks. If
Sorry,
you've got
Nick.
questions.
I think
Sorry.
some we're on mute.
Oh, sorry.
My fault, I was on mute. So
No
yeah, just saying, so our solution is fully confidential. And also we don't really collect information on crisis per se. However, because of the delivery model in HSPs,
we've trained up HSPs in terms of how to utilize the program and for them to work with their existing policies and procedures around managing risk. With the Breaking Free online platform itself, it has details for emergency services on the landing page. Equally, within the program itself, if people are accessing it, we don't elicit some of those responses that there may be in other programs looking at crisis. But we do provide access to lots of different coping methods for actually people to manage some of those difficulties. But people are directed to the emergency services through the landing page and the information that's presented that way.
Great, thank you so much. So I do have a series of questions here for all of our presenters, but I guess I'll go to MindBeacon first. And a question that we've heard from members before in the past, what's the difference between the free Ontario MindBeacon program versus the paid program? And Colin and Anthony, please weigh in.
Yeah, it's a good question. So right now, the free Ontario program available to everybody 16 and up through self-referral or a hospital model. So somebody has to come to our website or they go to the government website to sign up. In that case, the employer or employee don't know, the employer isn't aware that the person is using the service. When you undertake a contract with us for this kind of a service, you get, it's still a confidential service for employees, but as the employer, you get aggregated, de-identified information and reporting on utilization, the types of services that are being accessed, so it can help you identify hotspots. You get a targeted communication package. Anthony showed you that. It's a year-long program, so it can tuck into your occupational health and safety campaigns. We do Bell Let's Talk Day, Mental Illness Awareness Week, topical information by season, you know, if people are stressed out about their kids going back to school, those kind of things. You get a dedicated account executive who helps with the launch period. So we train people, managers, peers, champions, how to recognize that other people need help. So you get those kind of supports as well. The Ontario program is a COVID program. So we'll see what happens, you know, when that day comes, when we're out of multiple waves and all of the rest of it. So it is available free. And, you know, some people, they're reluctant to go see their HR department, but other people are reluctant to maybe use a government website. So what you want is a service that's available for people and their families when they're ready to reach out. You want to make it as easy as possible. We do know that MindBeacon pays for itself in reduced absenteeism days, sick days. And then when you factor in presenteeism, you're getting into the double-digit returns. Anthony, I don't know if you had anything else to add on that. Can't hear him if he's talking, so.
No, I don't, sorry. I don't have anything to add. Colin, you're spot on.
Okay.
Great, thanks, Colin. So next question to Nicole. Is Togetherall also free in Ontario? How would municipal employees get access to Togetherall? Is it just through the MindBeacon partnership?
Yeah, it's a good question. So we are not funded by the provincial government. So we do have a partnership, a very flexible partnership with MindBeacon. So we can either have a conversation with myself or with Colin and Anthony and team to figure out a path forward.
Thanks. So next question for Sarah and Glenn. Can we purchase services directly through Breaking Free? If so, what reporting do they provide back to us?
So it's an interesting question. We'd be happy to have a discussion with any of the organizations interested in exploring that further, you can actually access the full program itself for free. We would, however, be happy to sort of explore the reporting and support for HR departments around the utility of breaking free, the kind of engagement and uptake and the clinical outcomes resulting from that. But certainly at the moment, if a HR department or an organization wants to have additional conversations about additional services that we can provide beyond the free access for any of your employees, please feel free to reach out either directly to us or to info@breakingfreeonline.ca.
Hearing Glenn's voice just reminded me of one point that I wanted to underscore, and that's that we do a lot of cross-referral between Breaking Free and ourselves, because it's very common for people who have a psychological issue to also have a concurrent substance use issue. And we have our own alcohol protocol, but as Glenn said, there's 70 substance use issues that they deal with. And so we hand people back and forth all the time quite successfully.
Thanks. We'll make sure that we include contact information for all of our presenters today in the follow-up communication to attendees. So if you're interested in reaching out, you'll have their information to contact. So a few more questions here from me. Again, folks, if you're interested in asking our presenters a question, use the Q&A function through Zoom. And I guess this question goes back to MindBeacon. And again, another thing that we've heard through members since the partnership began. Can a member access the program through their existing benefits plan provider? It's to you, Colin.
Yep. Yeah, we're covered by all of the major carriers. And what we always say to people is, and it's a great relationship. What we find is that the uptake is significantly higher when you have an easier to access way to get employees to the service. So with many carriers, they have to pay out money in advance, and then they may not have room on their visa. They may not want their spouse to know they're accessing a service. They may want to save their benefits for something else if there's a limited wallet size. It's a good way to go, but 10 to 20 times higher uptake when there's a barrier-free access through a landing page at work or something like that. So there are other ways, many ways to access the service. And like I said before, you get the benefits as an employer of more specific reporting to your organization when you go through us versus through the carrier or the insurance benefits relationship.
Thanks, Colin. And another one for you as well, too. Another question that we get from members: can their agencies, like public health agency staff, get access to the offering? I know that there is a participant today from the City of Toronto as well, too, who is an AMO non-member that might be interested. Can they also access the AMO offering?
Sure, yeah, we're happy to talk to the various organizations that are out there and access the contract and rates that we've negotiated with AMO.
Okay, great, thank you. So I'm not seeing any further questions. I might just have one more again for all of our presenters here. Another issue that we have within Ontario is connectivity issues, especially when it comes to accessing digital services. When you get into areas in rural Ontario, accessing internet might be a bit of a challenge. So are there other alternatives to accessing your services? Can a member or their employee call directly, or is it just a digital interface? So I guess, Colin, I'll put it to you first.
Yeah, sure. So for our therapist guided program, it is an online offering. The relationship with the therapist is online. So anywhere where there's Wi-Fi, we do have people, and you can access the service through your phone, your tablet, or your PC. So we do have people who are living in, multi-generational households or the like, who may go to a public library and access the service there or something like that. So it is at the moment wherever there is Wi-Fi. Now our live therapy services that were included on there could also be done by phone or by video. So we have a mix of ways to access.
Nicole and Sarah and Glenn, would you like to weigh in too?
Yeah, I was just going to comment that our service is strictly an online safe mental health community. So it does require access in some way, shape, or form to the internet, but would echo what Colin sort of shared. You know, we do have many members who are many Canadian members who are using in sort of rural, remote areas and in sort of group living situations as well. And that sort of privacy is really critical to them getting access and support. So.
And from a Breaking Free perspective, although the program is online, if you can access it via the internet, via any health service provider across Ontario, any mental health service, employment agency, women's aid, you know, any of those kind of wraparound services that people are often in touch with. If you can create an account with Breaking Free Online, you can download all of the resources and action plans as you work through it. Those are all printable, or you can save them onto a USB stick or whatever format you'd like to. But equally with the companion app, the interventions are embedded, so you don't need connectivity. You can literally just access some of those interventions very discreetly on your smartphone without connectivity. But equally, we would always encourage digital inclusion. So for people to think through what in their local area is accessible for the internet, family members, friends, internet cafes, public libraries, all of those kind of resources, because in this day and age, we know how important it is to be connected.
Thanks everyone. Finally, a question again for me to all of our presenters. This is Cybersecurity Awareness Month in October. We did have a forum last week or 2 weeks ago on data security and on how municipalities can protect themselves, since they are being the targets of some of these threat actors out there. And there's a lot of personal information that's being inputted into these services. So what are your organizations doing in terms of the data security of your users?
Well, I know I can speak for Breaking Free and ourselves that we've gone through a very rigorous threat risk assessment and privacy impact assessment with the Ontario Health Agency and the Ontario Telemedicine Network. We all take privacy very seriously. All of our information sharing is consent-based, and we go through our annual SOC 2 testing and our penetration testing and all of the rest. And these were third-party assessments that were done by Ontario Health. And so we're always happy to, when we work with individual organizations, to share the results that came out of that. So it's a good question, and it's a very important one, and it's very intrinsic to what we do.
I'd say it was more rigorous than that, Colin. It was, but yeah, really pleased to have that process done and to be able to actually evidence that all of our data is very secure, and we do take privacy incredibly seriously. We know how important it is for individuals using the kind of services that we all offer.
And I'll add to that. We do not have an active privacy impact assessment with the Ontario government. We do with many other governments, including Alberta Health Services and Nova Scotia Authority, as well as a history of working with the National Health Service over in the UK. So I think we can, all three sort of providers can confidently say that we've been wrong upside down and backwards across various sort of PIA assessments and are confident in our practices.
Great. Thanks. I had to ask the question.
Yeah, no, totally.
And with that, thanks to Colin and Anthony from MindBeacon, Glenn and Sarah from Breaking Free, and Nicole from Togetherall for presenting today. A lot of good information here that I think our members will be chewing on in the days and months and years ahead. And thank you all to the attendees for listening and participating today. We really appreciate you taking up the time to listen to us. So thanks everyone, and take care.
Thank you, everyone.